she's, travelled down, especially just for us. And I really, really appreciate that, because you're not a local girl. Although I don't know whether you were at some point. I have no idea, but you can share that later. So today we're going to learn a little bit more about our local mental health services. It can be quite a minefield, Louise, honestly. Sometimes when you're looking for, especially when you're that person who's struggling, or you're the person who's supporting somebody who's struggling, and to try and, even do a Google of where to get help, it's all very confusing. So I'm hoping you're going to be able to help me today to maybe shed some light and help people navigate where they can go in terms of finding that help. So first of all, a little bit about Louise. So Louise is the Communications and Engagement Manager at Leicestershire Partnership Trust, and she has a background in marketing. Am I right, Louise? And she and I actually got involved a few years ago when she was involved in the consultation. So there was a local consultation here around mental health, which we will be talking about, to help develop the services that are now starting to be in play now. We're going to talk about that as well. And we are inviting you to ring in, call us on the studio line, which is 0116 482 2086. That's 0116 482 2086. Or you can text or WhatsApp us on 07748 855 055. That's 07748 855 055. Now, Louise, first of all, I'd like to know a little bit about yourself, and I'm sure our listeners would too. So tell us a little bit about yourself.
Well, I have travelled all the way. You're quite right, Rehana. I've come all the way over the border from Nottingham today. It's great to be here. I have worked in Leicester before. I worked for a company on New Star Road in Thurmaston. And a long time ago, it was in engineering. So I do know Leicester a little bit from there, and also have worked at Loughborough. So yes, I do know Leicester. I do like working here. We're based over at Glenfield at County Hall. But yeah, so I've been here in this role for about 3 years.
Wow.
And I came into here from really a physical health background. I worked for Active Lincolnshire in about physical activity, trying to get people more connected with being physically active. So it really links into the mental health work that we're doing around trying to get people to be active, to feel better physically, and then they feel better mentally. So I did that for a few years, and before that I worked quite a bit in sports marketing. So yeah.
Interesting. Yeah.
It's a difference to mental health, but it actually is very connected to how people feel well and feel good about themselves. It's physically and mentally well.
Yeah, so in a way, it's a progression of your journey and using those skills that you have to, maximise what you're able to do and reach people and make a difference. I think it's fantastic.
It is. No, I really enjoy it. I mean, since I started, we've been doing so much work with local communities and lots of different partners. So it's really enjoyable. And there's so many people that are passionate about making mental health services better. So, I'm here at the right time. There's a lot of investment going into mental health as we'll talk about today.
Yeah, that's fantastic. So do you mind me asking, so what did you study?
Many years ago, I did history degree, and then I did a postgraduate qualification in marketing.
Interesting.
Because I wanted to go into marketing, I had a real passion for that. So yes, that was quite a while ago that I did that. But yes, that's taken me into marketing communications and into the work I'm doing now.
So what is marketing and communications?
Well,
sorry, I have to ask.
It's everything. I mean, it's everything. I mean, it has changed since I started it. When I started, we didn't have things like the internet. We didn't have social media, and a lot of communication now is moved from using traditional media into using social media and using lots of different channels. There's a different way we communicate now, and it is more fragmented. And people aren't going to just the main media channels to get their news. So while it's good for communities and good for people, it just means that when you are communicating, you have to do lots more work, and you have to do lots more engagement. But yeah, so marketing is about promoting, whether it's a product, whether it's a service. It's about thinking about the audience that you're trying to capture, how you best communicate with that audience. Do you want to spend money on advertising and leaflets and brochures and all those sorts of things? So it's a whole mix of products that you pull together in a marketing campaign to make sure that you get the most interest for your product or service.
Yeah, so in terms of health, and obviously here we're talking about mental health, getting those messages across to people. And I suppose marketing was instrumental in terms of the pandemic and how we, communicated with the communities and reaching people in different ways, because as you said, not everybody uses mainstream media for their information, for their news. But it's also what type of information and how it's communicated. So I think you're absolutely right. But I mean, there are so many benefits to social media. If we look at it, I know there are the disadvantages as well, but there are many benefits. It's how quickly messages can spread in terms of the positive stuff. I'm not on about the trolls and all the other stuff, but I'm on about the good stuff, and how quickly people can share that information, and the fact that somebody they trust has shared that, then that is able to spread that message on. It was the same with the vaccinations, wasn't it?
Well, I think it's interesting you talk about that, because there's lots of people in the pandemic turned to the main media, didn't they, to get quite simple messages. Remember those 3-word messages?
Oh, yes.
And it's about simplicity. And I think the government then worked with local communities to distill those down. And you're right, using trusted voices and trusted channels to get those messages out to communities. There's a whole lot of work done during COVID on that. And I think the NHS has benefited from that work, and they're still using those routes now. Things like vaccine hesitancy, promoting the fact that the benefits of the vaccine, that the things that they did back at the start of the pandemic, they're still doing now. So it's been such an interesting time for the NHS in learning how to work better with its local community.
And it's better for all of us, isn't it? It's great stuff, and it's good to hear that they're still, using those methods. Because they've tried and tested them and they know they work. And I think a big part of that has been involving communities, community organisations, community leaders, using the skills and the knowledge that they have on the ground, and also their understanding of the cultures and the languages. And I think there was a time when all the community leaders did recordings and they were shared on social media, and how powerful they were. So I think marketing has a massive role to play in all of this. So I know you mentioned the word product, but and obviously that's common word in marketing, but it's the benefits of whatever it is that you're selling, the idea, the message, whatever it is. So again, with mental health, this is really, really important stuff. So Louise, what made you actually decide to work for the NHS? Because you said you were working in sports marketing and then moved on to this. So what made you do this? What made you think NHS?
Well, I saw the role in working in the comms team within Leicestershire Partnership Trust, and then an opportunity came up to work in the transformation team. And the transformation team is the team that's looking after this whole big piece around mental health. And they wanted somebody to come in and do the engagement and communication around the consultation and the transformation. So I came across then to do that piece of work, and it's been such an interesting job. I mean, when I took it on, I just thought it was around the consultation, but the scale of work and the scale of change that we're now involved in is really interesting. So, yeah, I saw it, and luckily enough, I managed to get the opportunity, and then it's just been such an interesting role. So
the fact that you envisage something and you go into it and you realise it just opens up so many doors. So anybody interested in communications and marketing and those kind of jobs, go for it. Yeah,
I think it's also worth saying there has been an expansion in general roles within the NHS, and we've had recruitment fairs recently trying to get more people to come and work for us, and more people from every community.
Yeah.
It's really important that we get that mix of people. And I think even within our team, within the transformation team, we've just employed 11 people.
Wow.
To go out into the local community now to build those community links and build those local mental health teams and awareness. So there are lots more roles now, and whether it's in the GP practice or whether in the community. But there are those roles. If people are interested in a career in the NHS, it's worth looking on the job site and keeping on top of what's going out there.
So now is the time, yeah?
Definitely.
And we need more representation, so it's really, really important. I mean, if we're going to improve the services that we all receive, be part of it, yeah. Thank you for that. So there's something called the NHS long-term plan, and I'm not assuming all our listeners know about it, but this long-term plan was a 5-year plan that was developed, yeah? Do you want to tell me just a little bit about it and then what it says about mental health?
Well, we talk about the long-term plan a lot, don't we? And it's sent out in 2019 and it was seen to be a modernisation of the NHS. So the NHS, we all know, that was set up just after the war, was dealing with a very different population, a very different life expectancy, and with a lot fewer treatments for health. So the plan was looking around, how do we modernise this health service that's fit for this generation? And it was going all the way back to early years, right through to old age, and how we manage people's health throughout that whole lifespan. And one of the big changes was around creating this integrated care system. So that looked after everybody's care needs, everybody's health needs. So whether it's prevention, whether it's exercise and diet and all the things that keep you well, through to when you do get ill, through to treatment. So it was about that whole person-centred, seamless approach to looking after yourself. And how do we have those services that can enable us to do that? And then coming from that came the community framework for mental health. And that sort of detailed how the local community offer was going to be changed for mental health in relation to this person-centred approach. So how do we make sure we build services around the person, the customer, for marketing terms, but that customer should be king, and how do we make sure that what we're delivering for that customer is right for that customer, that whole care system. So that's what we're trying to do as part of that long-term plan and the framework for community mental health is develop this seamless process from GP through to community care through to acute care when you actually do maybe need to go into hospital. So it's about this whole change in approach to health so that we can start to develop a better system to meet people's needs.
That's good to hear. And you mentioned integrated care. So what does that mean?
Yes, well, I'm sure people know that we created the integrated care system last year. This is very exciting. We launched it in Leicestershire in last July, actually. And we've been working at this integrated care system now since then. And what it is, it's about bringing all the services for health together. And we bring health together with the voluntary sector, which I know we as two have worked quite a bit on, but bringing the voluntary sector in, but also bringing the local authorities in. Yes. So all the partners that are involved in delivering great care to communities are coming together in an integrated way. So we're working better together. We're not overlapping. We're pooling resources better, and we're also talking better to each other and planning better to each other.
Yes.
So, for example, the local wellbeing strategy that the city and the county and Rutland have, we're working quite closely on those now from a health point of view, because they've traditionally just looked at prevention without a lot of integration. But there's more integration now going on about how do we keep people well. How do we stop people getting ill in the first place? And how do we keep them well in their local community? So that's very much the direction we're all heading in.
It's really good to hear. And what I was going to say was, in terms of the NHS long-term plan, I'm just going to read out one of the quotes from there. We need to put greater energy into prevention, just as you've said, rather than waiting until people reach crisis point. So what I'm hearing is this is what you're all trying to do together in an integrated way, us as the voluntary sector and obviously the NHS and the local authority working together here locally, what we're doing in order to prevent people reaching those crisis points. How can we help in terms of preventing people developing mental health problems, build that resilience, but also when they do need help, what help is there out there in their communities before it gets to those points where then people have to be hospitalised or even worse. So.
Yeah, I think you're quite right. It's about getting earlier help, and particularly around mental health. It's still such a taboo for people to say that I can't cope. I don't feel great. My life's getting on top of me. I don't feel like I've got no value in myself. So we are still seeing people that don't talk to people until it's too late, or they reach rock bottom and they potentially have to go into hospital for treatment. And what we're trying to do, and we've done quite a lot of work with local communities, and there's still a lot of work to do, is around it's okay to ask for help. And if you do ask for help, there are more services out there. So we are talking about a growing investment in mental health at the moment. I mean, the new roles that have come in, both at the GP and the community service, that we can talk about it a bit more, but there's an expansion now of support for communities, for people to get that help that they need and have that earlier conversation. So we can go through some of those that are available if people are interested.
And that's really, really good to know that investment is going in, especially right now when we know that NHS are in crisis and the demand for services are increasing. But it's really good to hear from you that you're actually encouraging people to actually reach out when they're struggling. And I suppose that's because we know that long term, if people don't reach out, the consequences of that. So what we're saying is, look, if you are struggling, reach out early. So 2 things. One, we could quickly touch upon the public consultation, because that's when you kind of came into this role. But so locally, there was a public consultation in 2021. Tell us a little bit about it, and what did you find?
Well, we did it, it was done by the clinical commissioning groups, and they did it on the services that Leicestershire Partnership Trust deliver. We had 6,500 people respond to that public consultation. Wow. It was incredible, and the level of interest that we had from people was bigger than we thought. And it led to an endorsement of the plans that we wanted to make. I mean, things like the central access point, which is a 24/7 phone number. We brought that in very quickly during COVID, and there was an endorsement for that to carry on, an endorsement that we needed to invest in the central access point. And then there was also an endorsement of bringing more services to the local community, which is the work that's happening right now. So more services that people can get more quickly, bigger teams in the local community, and bigger teams delivering more services. So that was a big endorsement of that.
I mean, that's fantastic, considering it was during the pandemic as well. So good response and well done. I know you used lots of different ways of engaging with people, and not just the generic type of people that may respond to surveys. So well done. So you mentioned the mental health central access point. So I'm just going to give everyone the telephone number for that. So the central access point phone service. So this is if you or someone you care about needs urgent advice or support for their mental health. So it's a 24-hour line, 7 days a week, and it's free, and it's in confidence. So the number is 0808 800 3302. So that number is 0808 800 3302. Now, how can I get that information online? So say I've not got that number down. Yeah, where would I go?
It does exist on a few websites. Yeah, it's a good question. It's on the Leicestershire Partnership Trust website. It's on the county and the city websites and on the Rutland website. So it is around in a lot of places. But yes, it's hopefully you'll see that if you go onto those different websites, it's publicised on there.
So as a result of the consultation, you've changed the way you work, and you've expanded the services you offer and developed the services you had. So tell us a little bit about those.
Wow. I suppose the big thing now at the moment we're doing is we are creating planned treatment and recovery teams.
What's that?
Well, we've got lots more people. We're bringing all our services together. So if you think about say if you get ill and you come into the community mental health team for your treatment, we're bringing more of our professionals into that team. So we have community mental health teams within communities already. Yeah. I'm going to play dumb a bit.
Sorry.
You do. Sorry, in the city you have mental health teams. You've got the City East, City West and City Central teams. We have our psychiatrists, psychologists, our psychiatric nurses there, our occupational therapists there. And we have all the professionals around located there. And we're bringing more services in there. So people, if they're ill in a certain part of the city, we bring the service to that person, and we're reconfiguring all those teams at the moment. And the other expansion, we've got things like peer support workers coming in. So these are people with lived experience who are coming in to work in the NHS within mental health to offer that expertise. And that's another area that we are recruiting for, the peer support worker.
So if you are interested, there are peer mental health support worker opportunities if you have lived experience, and you get full training as well, don't you?
You do.
And it's a paid role, am I right?
Yes, they're paid roles.
Excellent.
And you can be full-time or part-time, because when people have had mental health, they sometimes don't want to go into a full-time role, and they just want to start getting back into work, or you can volunteer.
And I'm assuming because these are people with lived experiences, there is additional support available for them as well.
Yes, they're part of a team, and they're made to feel like part of a team. And then when they go into their local team, they're very much nurtured into that role, and they're helping people like themselves. So that is a new role that not a lot of people would know about, but it is now a role that we are always recruiting for.
Just wanted to say you're listening to Ramadan FM on 87.7 FM. If you have a question for Louise, we're talking about local mental health services, give us a call on 0116 482 2086, or you can text or WhatsApp on 077 48 855 055. Now, one of the things that I'd love you to share about is the investment in the voluntary sector and what services in partnership with yourselves they are offering.
Yeah, so what I said earlier, this is a period of investment into mental health. And we've recently done 3 rounds of funding going into our local voluntary sector partners. And the programme is called Getting Help in Neighbourhoods. We've given out 28 grants in round 1. We've given out 23 in round 2.
Wow.
And we've just recently re-awarded round 1. So that is a significant investment into about 50 partners who are going out, working with us to deliver mental health support for people in local neighbourhoods. So it's been a fantastic programme, and the partners in it are doing such amazing work. I mean, we had 4 partners on a call yesterday with our community mental health team, just talking about some of the work they're doing. And the members of staff at the Trust were overwhelmed with the sort of work they were doing and the impact they were having on people's lives. So it's been such a success with bringing these 50 partners. And I suppose those 50 partners have come in to work with us. But when we did the public consultation, we had about 40 voluntary sector partners that helped us with the public consultation. And when we finished it, the overwhelming response for those partners was that we want to stay working with you. We want to stay involved in mental health. We want to be part of the change. So that was one of the outcomes of the public consultation, that the voluntary sector were very much part of how we're going to bring about this change, which is, it's been a really positive period of time.
Yeah, and it's going from strength to strength as well. So we have this alliance, I was going to say network, VCSE Alliance, that obviously we're both part of, and it's just fantastic because not only is the voluntary sector a partner, but we are valued, we are heard, and we're involved in the decision making and influencing those decisions because obviously we have the knowledge on the ground. So it's fantastic to hear. Now, the Getting Help Neighbourhoods, I mean, I was fortunate to be at a mental health partnership board meeting where some of those groups that were awarded those grants, they presented, and the work is amazing. The groups, what they've achieved, and they've exceeded outcomes, and the benefits to our people on the ground is just amazing. So I'm really pleased that the LPT, Leicestershire Partnership Trust, and everybody else who's involved has decided to basically fund these organisations and also renew those grants. So it's wonderful to hear, because that means people with mental health problems are able to access services, not necessarily in terms of clinical services, but are able to go into a very voluntary sector environment, a community organisation, something that's based in their community. Nobody needs to really know about. It may be just early intervention, it may be just low-level support, and just get some help. Maybe they're feeling isolated and lonely, and before it becomes something. So it's really, really good to hear, and also the prevention work. Crisis cafes, Louise.
I knew I could see you looking at that in your booklet there. Yes, interesting time. I mean, again, this is investment in the voluntary community sector, and we're starting to get a massive network. We're up to 15 cafes at the moment, and we're about to launch the next 10.
Wow.
So that will take us to 25, and these 25 cover Leicestershire, and they cover Rutland. We have quite a lot in the city. Obviously, we've had probably half the population in our city, so you'd expect we have a lot here. We just had the interviews for the next round, and we will be going out to an announcement fairly soon on those that have been successful. And it is an exciting time, because we've had some charities that are quite large, national charities, but what we also have had is small local charities winning the cafes, which is it's testament to the strength of some of the community partners that are working with us. So,
and I think what's been really interesting for me to see the types of crisis cafes. When we say crisis cafes, what do we mean, first of all, Louise?
Well, the name of the crisis
cafe, which is discussion at the moment.
So Rehana knows full well that we are reviewing the name Crisis Cafe. We've had some feedbacks. For some people it works because I feel like I'm in a crisis. I need to go and talk to somebody. But for some people, and we have had notes of this, that they feel that they're not quite in a crisis enough to go and talk to somebody. But what these crisis cafes are aimed at is it's more support for people in local communities. So if you're feeling like you can't cope, you just need to talk to somebody, something's bothering you, you feel overwhelmed or anything like that, you can walk into a crisis cafe without an appointment. There's no referral. It's not official NHS. No one's going to be logging you. You can just walk and have that confidential conversation with somebody who's there to listen. And if that person through the conversation feels that you need more help, then that person will put you in touch with the right services and make sure that you're navigated into getting some support, or the support that you need.
So as a first port of call, a crisis cafe is a good place to go. And obviously we have them dotted around the city and the county. And again, if you go to the Leicestershire Partnership Trust website, you'll be able to find those quite easily. And you've got some really good information on the website, very simple to understand, and different languages as well. So that's good to know. And you've got a barcode on all your literature as well, so people can just scan and it comes up, which is great. It's great. Maybe hold one up, and I'll hold it up as well. There we go. We can see one of those. There you go. Yeah, lovely. So the crisis cafe is another place to go as well. What if that's not enough?
Well, it's interesting because the only place people could go to until recently was the GP. And people often go to GPs, they're difficult to see the GP, but also the GP doesn't always know where to send somebody. So the crisis cafes are one place, the central access point is another place. We've also got the mental health and wellbeing recovery service, which is located in the city. This provider for the city is P3. Again, it's on the website for Leicestershire Partnership Trust, and they're there to help people who are feeling those lower levels of mental health distress. It might be around debt, it might be around cost of living, it might be around to do with their job or their neighbourhood, it might be relationships. So it's all those low-level issues that you might have problems with that they can help you. So that is another area of support that's now available. Again, that's just you can access it yourself. You can ring up, you can email them, and you can book yourself in for an appointment.
Thank you for that. We have a question now, Louise. I forgot my glasses, so if I make a mistake, correct me, please. How do we make sure mental and emotional abuse, bullying and neglect comes to a total end? Because thousands of people I know across UK, for example, Muslims, are suffering from behaviour, emotional and mental issues from childhood into teenage years and adulthood too, due to massive stigma and complete lack of knowledge too about mental health and emotional health care, rights that they have, which is being deprived of without anyone to help them.
Wow.
Big one.
Yeah, and I think we were just previously talking about investing in some of our community partners, and you yourself, Rehana, and some of the other partners like the Shamma Women's Centre that I know, Community Links, etc. We've got a number of partners now who are investing in to start to deliver some services. Living Without Abuse, for example, is another partner that we're investing in. Yeah. So we're trying to make sure that the people that can deliver some of this anti-stigma awareness-raising work have the funds and the means to go and continue to expand the work that they're doing. But you're quite right, there is still a lot of stigma going on around these issues, which we are trying to invest in the partners that can help us to eradicate this.
And what I can say to that person who messaged in is we had a show last week where we focused on mental health stigma quite a lot, especially in Muslim communities, as you mentioned. And one of the main things that came out of that show was that the education isn't there. So we need to keep talking about mental health, normalising mental health conversations, and increasing that awareness, but also educating ourselves so that stigma is reduced. We've got a message. Thank you for this much needed awareness on mental health support and how to access the emergency services for this area. Really interested in the mental health peer support, as I have lived experience as well as recently qualified as a counsellor, and would love to be involved in the peer support work. That's brilliant. So get in touch with the Leicestershire Partnership Trust. We got another one. And thus their future is often sometimes damaged for life. And so I think this is in response to the one before, for life, and so they don't even have the ability to access mental health care services, even if they know about it, due to abusive environment, which they're not responsible for getting out of, usually due to example being below the age of 16, now below 18, thus can't be blamed too. So this getting out of help, so what I would say is things like Childline and Muslim Youth Helpline are two services that are worth ringing up. So they're anonymous and your family members don't need to know anything about it. So if you are feeling like you're in a situation where you're in an abusive situation and you are a young person, I would suggest Childline, NSPCC, also Barnardo's is a good one, and Muslim Youth Helpline. If you're an adult, you just mentioned Living Without Abuse, so that's another organisation you could contact. You mentioned Shama Women's Centre, ourselves, Jamila's Legacy as well. There are lots of support out there. So we will be thinking of you and making prayers for you as well. And I hope and pray that you get the help that you need, and hopefully sending you lots of healing prayers. Okay, so what about people who are really in crisis? What happens to them? And say they're so ill, these crisis cafes can't help, the Getting Help in Neighbourhood projects can't help them, the mental health teams can't help them, the GP can't help them. So we're at this point now where somebody is severely mentally ill. What happens?
If they have got past the point where they do need potentially to just be assessed and just be calmed down mentally and get some treatment, then they would potentially go into the Bradgate unit and have an assessment, get a psychiatrist to look at their health and do a diagnosis, because if they can't cope and the GP can't cope, they will be referred into the Bradgate unit.
So is that something you willingly do? You go in?
You can go in. Yeah.
Okay, and what if you're basically saying no and your family are saying no, you're too unwell, you're at risk of harming yourself, or you're just in a state where things are not looking good at all, you're not listening to the GP? What happens in that situation?
Well, yeah, that's a very difficult situation. It's very rare, fortunately, but that would be somebody would probably fall under a section under the Mental Health Act and be taken in for assessment and to make sure that they're safe and they're getting the treatment that they need.
Okay, so this is the Mental Health Act when you're talking about sections, so there's some legal powers there.
Yes.
I mean, they're not often used, so we don't want to scare people, but if somebody's very seriously ill and at risk of causing harm to themselves, then it may be used because they're so poorly and they need treatment, so they need to be hospitalised. So Bradgate unit is a unit within the hospital?
Yes, it's based at the Glenfield, and that's where somebody would go and be assessed and get the best people in our county to look at them and to make sure that they get the right diagnosis and they get the right treatment so they can get home as quickly as they can.
That's good to hear. I think we've got a further message from that young person. So Louise, perhaps you can help me with this as well. Yes, but many people across UK do not even know about these services. For example, kids below the age of 11 across the UK, how can we ensure that they are not deprived of their mental health care rights? I mean, school has a huge part to play, don't they?
Yeah, I was just going to say there is investment in mental health within the school network. So there are mental health practitioners in schools. We're rolling more of those out across the school network. The schools also have school nurses, and they're all probably also other members of staff who are those pastoral leads for children. And I think if you are feeling ill and you are under the age of 18 and some of the issues you've raised about family or pressure, then school would be a good place to start. If you trust a teacher or somebody in that professional capacity, just that first conversation with somebody that can really give you that best advice is the best way to start. I would say the school is set up very well to do that. We've also got an online service that we invest in called Couth, which is if you want to just explore and find some answers online, Couth can be, I'm just saying, Rehana, it's in the book. So Couth is also a good place. There's a page on there for children and young people. But yes, you're quite right. Sometimes young people don't know where to go and they feel like they can't cope.
And I think with this, do you want to read it out here?
Yeah, so it's just couth.com, and it's really aimed at young people. So have a look at that. We've also got we've listed Childline in here, which is a great resource, and also we've got Chat Health that we also invest in, and that's an online. And sometimes young people want to use the the chats function. So have a look at that as well. Chat Health is chathealth.nhs.uk, and then you just go onto your local.
And that's for 11 to 19-year-olds.
Yes.
It's a confidential text messaging service, so that's good as well. And there's also the Shout, which is a voluntary sector, a text messaging service. That's a good one as well. But also to say, within the schools, a lot of staff have mental health first aid training. I was speaking to a college yesterday who was telling me about how many of his staff have been trained, but also around the pastoral care team. There are services there. There is usually at least one counsellor, school counsellor, in many of the schools now, and you're saying you're investing in more, so that's great to hear. Sorry about the voice, the fasting. But also, I think we're normalising within the school settings, and I come from school background, so I know we talk about from a very early age in PSHCE, but also within our classroom settings about our feelings, our emotions, how to understand them, and where to go to get help and to keep safe. All of those things that is happening out there already, and access to information. You know, even if you look at focus on children's programs, there's focus on mental health. Even in terms of the activities children do, there's an element of mental health in there as well, whether that's connecting with nature, sports, etc. So there are lots of different ways out there, and I hope, you know, that we continue to focus on that, because young people's mental health is a priority, and I'm glad it's your priority as well. We know that there is a 50% increase in terms of young people and children since the pandemic who are expressing that they are struggling with their mental health. And I think the local wellbeing, health and wellbeing strategy board found 1 in 10 young people are reporting that they're struggling.
So one big change for children and young people services is that they can now self-refer.
Oh.
So that is a change. And so, again, children who are deemed to be old enough to do that, so it's around the age of 13. So the NHS now is allowing young people to refer into mental health services now, and that's just recently happened. So if people haven't heard about that yet, that's because that's just changed.
Okay.
And that means that you don't have to go to your GP. You can do that as a young person. So it's giving more power to that person to make that first move.
So 13-year-olds can call where?
I know you're going to ask me that. So it's
I'm
just
sorry.
changing now, Rehana, and I will find the information for you. But it's just being launched, this new self-referral service.
It's fantastic. Yeah. I'm really, really pleased to hear that. I mean, and more so with that message, those messages that we've just had, where they can't trust their people around them. Look, if you are struggling, find somebody you trust, even if that is starting with a friend. It could be a family friend. It could be a relative who you can trust, who has nothing to do with the people in your home, an auntie or a distant relative. It could be somebody in the community. It could be a community organisation. Get in touch with somebody you trust if you don't want to go to a professional as a starting point. Or, as Louise said, somebody in school, and reach out. Don't, struggle and become isolated, and things deteriorate quickly, as we all know. So please do reach out and get help, and all those other services we talked about. Louise, you're going to pass on that information to me, so maybe in the following weeks when I'm on my show, I can share that information. But I'm really, really pleased to hear that, because you and I know that we're dealing with an increase in demand. And in a way, you've kind of shared the question I was going to ask you. How are you dealing with the increase in demand? So perhaps repeat just what you said before.
Lots of things, really. I mean, increasing the capacity, because we know capacity is, with the need is greater. So increasing capacity within the NHS to have more people to deliver more services, investing in the voluntary sector. And it's not just the NHS that are doing that. The City Council are investing a lot into more services to help people with their health and well-being. The other thing we're doing behind the scenes is we're reviewing things like waiting lists to make sure that we're trying to move people through more quickly.
Yeah.
And that also is the planned treatment and recovery teams. The team that you asked me to explain. So how do we get that team working more efficiently so that we can get people treated more efficiently and effectively? Because we know there's demand, but how do we make sure we are maximising our service to deal with the customer in the most efficient way, so they get the best treatment for them?
And that's really good to hear, because sometimes you end up in the wrong places. You may end up at A&E, when you actually might have, benefited from another service, and not wait for so long.
We've invested in people at A&E, so we've got mental health trained people at A&E. So if anybody does go in there, they've got a mental health problem, then we've got people there that can help give them the support that they need. So again, that's another service now.
So they're able to signpost and refer quickly
yes.
to where they can get the treatment that they need instead of having to wait in A&E.
Yes.
That's really, really good to hear. You mentioned the local authority as well, and actually it's quite relevant to what we've been talking about, because one of their priorities within their Leicester's Care, Health and Wellbeing Strategy 2022 to 2027 is around mental health, and the theme, the theme is mental health. So the key issues affecting mental health, for example, in Leicester, is around preventing deaths by suicide and mental health of children and young people and engagement with the local environment. So the show before us, Rehana was talking about the environment, so that engaging with the local environment and how that can help people's mental health. And the fact I mentioned earlier that 1 in 10 children report having a mental health problem. More say they feel stressed or overwhelmed. So that service you just mentioned, I'm hoping to be able to share more information over the next few weeks about that. That's going to help promote resilience and help people, young people get that help they need quickly. And the last one is preventing death by suicide. And I touched upon this last week as well. So around 30 people die by suicide in Leicester each year. I know that's increased. I haven't got the recent data, but suicide can be influenced by a complex mix of adverse life experiences such as relationship breakdowns, bereavement, debt and unemployment. And it's what the local authority and even the Leicestershire Partnership Trust is doing, and also our role as the voluntary sector, what we can do to help, because regardless of what faith you're from or what background you're from, suicide happens in all of our communities. And what can we all do to prevent that? We all have a role to play, because if this stigma continues and people can't reach out when they're struggling and they haven't got nowhere to go, that deterioration happens very quickly. We can help this by normalising and by providing that support. Any thoughts on that, Louise?
Totally agree with what you just said, and I think all of us have a responsibility. If anybody that we know, if we see them, see them acting differently, or that you see people under stress, that they might be affected by debt or relationship breakdown that you've just mentioned, all of us have a role to play in making sure that everyone is okay. Definitely anti-stigma about feeling mentally unwell, and I know that we work with lots of community groups, and some of them say they don't have a word for mental health and they don't talk about it in their language. So the people like yourself and all the other leaders that we're working with who are having these conversations with people, it starts to break down barriers, and people are accessing services earlier, but we can only keep pushing this message out that just talk to somebody, and if it isn't a professional, if it's a friend or a family member, then make sure you do talk to somebody as early as you can, and that's for all ages.
Thank you, Louise, and that's really, really good to hear. And you talking about mental health stigma, I was just going to say Jamila's Legacy is offering a free training course. So we are running a free training course on mental health in South Asian communities, and that's particularly focusing on stigma, shame and secrecy, and that's running in May at Madani School, and then it's going to be running at the Highfield Centre in June. So it's a free 2-day course, so you can find the information on Eventbrite or on Jamila's Legacy social media handles as well. So that's something for you to, if you're interested in learning more. And not only is it going to equip you, but it's going to help you support other people out there, and I think it's really important that we do that. So my final thoughts are taking ownership of our mental health is really, really important. Self-care is really important. What can you do to take care of your mental health? What are you currently doing? What could you do more of? And what else could you do? Because I think first and foremost, we, as Muslims, know that we are responsible for our bodies and our minds and taking care of it. This is a gift from God, and the responsibility ultimately lies with us. So what are you doing in terms of self-care and maintaining your mental health? That's really good start. If you're not doing something about it, then maybe now is the time to start. Ramadan is the best time to start. We're reflecting on everything we're doing. We're on a more of a slower track where we're stopping and focusing on what we're doing. So this is a good time to maybe invest in your mental health and your care, and take stock of what we're already doing and maybe increase some of that as well. If you're somebody who's listening and is struggling, and as Louise has said and I have said, please do reach out for help. And the local number. I'm going to read it out again. So this is the 24-hour central access point for mental health, 0808 800 3302. Thank you so much for listening. Thank you to my guests, Louise O'Reilly, and also thank you to Ramadan FM for giving me the opportunity to shine a light on mental health. Jazakallah.